So as a clinical psychologist from background, but also graduated in humanitarian program management, I can take different hats while working in the humanitarian sectors. I have first started working as clinical psychologist in HIV/AIDS centers in Congo, Brazzaville for a year, where my responsibilities were to ensure care to patients in 3 health centers and ensure observance in their treatment, as well as therapy. I also built capacity of local psychosocial officers that were in charge of following up patients. After this first experience, I have moved to Lebanon to join an international NGO to ensure a deputy project manager position as well as MHPSS officer after several weeks. My missions were to support the child protection project manager to ensure implementation of activities, conduct field visits, and support technical staff through job training, design of activities, and capacity building. After 4 months, I have joined another international NGO in Iraq as deputy project manager as well, in charge of implementing a victim assistance project in IDPs informal camps in Nineveh region, next to Mosul. My responsibilities were various, from conducting need and gas assessment in operating areas as well as new geographical area, preparing internal and external report, providing technical training to psychosocial workers and physiotherapists, ensuring a job supervision and planning activities for staff. On the side of the technical expertise and skills building, a lot of management were part of the responsibilities by leading 35 national staff in 3 different locations in the country. After this experience, I took a break and decided to join a French medical NGO as MHPSS coordinator in Central African Republic. My responsibilities were again split between my technical expertise by building capacity for staff, as well as local partners in purpose to implement qualitative activities. Our program was focusing on medical activities and gender-based violence, where MHPSS were fully integrating in the whole program. My duties were a lot of staff management to ensure coordination between departments and program implementation, as well as partnership management and building capacity. I was also really active in the network at the country level by leading the MHPSS subcluster with WHO, the Ministry of Health, and other main INGO. Part of my work was as well to explore new opportunities and conduct need and gas assessment to design new projects. A constant analysis of the context was key to ensure appropriate response and development of new one. After a year and a half, I left the mission to rest and look for another challenge. I am today head of program for an international NGO in Jordan with a strong focus on humanitarian response, youth and women's rights, with a strong appeal to shifting power to local stakeholders and reducing poverty. My job is less linked to MHPSS today, even if some component of program the program have some PSS activity and GBV case management. However, my responsibilities today are mainly to manage a program team in 2 countries for the moment and planning to expand to new countries in the next months. I am in charge of ensuring right and timely implementation of the program, ensuring that all deadlines and donor requests are fulfilled, and development strategy by looking for funding opportunities and submitting project proposal. I'm also in charge of strengthening and ensuring a qualitative relation with our affiliates and donors.